Whether brought about by injury or medical problems, joint pain can interfere with your lifestyle. With a look at the causes and conditions that might make you a candidate for joint replacement surgery, here is Dr. Stephen Barnett of St. Joseph Hospital in Orange.
The most common cause that leads someone to have a joint replacement is they get arthritis in their joint. It can be for different reasons, either wear and tear on the joint over time, or they could have had an injury in the past that damaged cartilage. Sometimes we see patients with inflammatory disorders like rheumatoid arthritis, which leads to a destruction of the joint. And the end sequelae of all of this is that it hurts to move the joint and the joint gets stiff. When the patient gets to the point where that pain and stiffness is interfering with their lifestyle, then they become a candidate to have the joint replaced. The most common joints that you'll see replaced are the hip and the knee. By far, that's probably over 95%. However, more recently they're doing ankle joint replacements, and most of the symptomatic degenerative changes are in the weight-bearing joints, usually in the lower extremities. However, we do see a fair amount of end-stage arthritis in the shoulder, and we have replacements for the shoulders as well. With current technology, and especially with the newer designs of what we call hard-on-hard bearing surfaces, the joints can last anywhere from 15 to 30 years now, which wasn't always the case. That's allowed us as orthopedic surgeons to start using these devices in younger and younger, more active patients, because that was one of the limiting factors early on, was that the joint would wear out. So you would hesitate putting a joint in someone who was in their 30s or 40s because you're looking at multiple surgeries down the road. Generally, patients are in the hospital for about 3 to 5 days, at which point, once their pain is controlled and they're ready to be discharged, a fair number of patients will go to a rehabilitation center for a short period, either 1 to 2 weeks, where they'll get intensive therapy and trying to get them back up on their feet. The majority of patients that we do allow them to put full weight on it from the first day, and we encourage them to get up with therapy the first day and start working on mobilization. Subsequent to their rehab stay, they will go home, and at that point a therapist will come out to the house up to about the 6-week mark. And at that point the patients are getting fairly mobile. The hips tend to bounce back a little quicker than the knees do. But at about 6 weeks, the patients will start a course of outpatient therapy and start becoming more and more independent. With any procedure, there's complications that are associated with it. One of the reasons I like joint replacement surgery so much is the patients overall do very well, and upwards of 95 to 97% of patients will come back, and once they get over that initial rehabilitation period, they are markedly better, and the majority of those will say, I should have done this 2 years ago, because they realize how much pain and disability they were living with prior to the replacement. So it's a fantastic procedure.